I mainly see people who have needs around their care and sort of their personal care and domestic care, how they manage their daily living. I do think you need to realize how MS often fluctuates for people. So I think that's certainly something that I've learned more about as I've worked with lots of people with MS. And it's something that needs to be reflected in the assessment that I do. So especially like, to ask the person, what is it like if you have a bad day? If people have relapses, then we can also put in place like a prevention of admission care package, which is free of charge for the client, and that would be a care package for 2 weeks to help them perhaps around their personal care and domestic tasks for that time to sort of regain strength and get back to where they were before. So that's a special service as well that's provided through Enable. Yeah. And the same is again supporting people to get back into normal life when they've been in hospital. So supported discharge again is something that will save money and will offer that additional support. People are diagnosed at some point in life, but it's not a condition they were born with. So their identity is not as strongly, I'm someone with a physical disability. I believe, most clients try to maintain as much of their independence of their ordinary life as possible. So the concern there would probably be that they would lose some of that independence and some of that control in life in case their health deteriorated further. Mm-hmm. So I think if it's someone who's still able to continue working and maintain their relationships and just their normal daily living, they might worry about the future and are there support through social services in the future. One thing, I think then if it's people who are further down the line or whose condition have progressed more, it would be more around maintaining the current level of care that they're receiving, a concern about the care being cut in any way or changed. It's another pace and another way of working. So I definitely feel I'm able to do more for the clients when I work in Enable. I can do some extra home visits, whereas if I was in the main team I would do mainly one assessment visit.